Well, we are here today with Dr. Andrew Lee, who is among the faculty at this year's COPHy, or the Congress on Controversies in Ophthalmology meeting taking place in Poland. And so we'd love to talk to you. I know you've been delegated or designated to present on the no perspective of this particular argument. And so let's just jump right in. So, Dr. Lee, do GLP-1 agonists cause NAION?
So NAION, non-arteritic anterior ischemic optic neuropathy, is basically a small vessel ischemia to the optic nerve. So the new agents, the GLP-1 agents, have been associated with NAION in several retrospective cohort studies. And that risk is somewhere between 2 and 4x for diabetics and maybe as high as 7 times higher for patients who are obese. The problem, of course, is that patients who are taking these agents need it for weight loss. And so there's overlap between the people that need the drug because they have vasculopathic risk factors, including their weight, and the people who would get NION. So a study like the ones that have been done already cannot really answer the question of causation. They can make a suggestion. And from my perspective, what I will be saying at the meeting is the answer is no. We do not have evidence for causation yet. So there is association, but association is not causation. And there are a number of examples that people might be able to relate to this that show a similar type thing. So, for example, here in Texas, we go to the beach at Galveston, and in the summertime, ice cream sales will go up because it's hot, and shark attacks will go up. But even though both of those things are associated, they're not causally associated. So skipping the ice cream will not protect you against the shark, even though ice cream sales and shark attacks are definitely associated. And the reason they're associated is summer, hot, the beach. So association is not causation. The second reason that I believe it's no is there's no really good biologically plausible mechanism, at least at this time, for why these agents would cause NAION. NAION is a small vessel ischemic disease of the optic nerve, and there's no real reason why an agent that's supposed to help you lose weight and make your sugar better would cause this. So my vote at COPHy for this question is no.
And you kind of alluded to some of this, but what do current clinical trials or real-world data, what do they suggest about the incidence of NAION patients or in patients who are using GLP-1 agonists?
Yeah, so NAION is already a relatively uncommon disease. It's not like some of our other more common things like multiple sclerosis. And so it's going to require big data to answer a question about an uncommon thing occurring more often in one population or another. So the normal way to answer a question like this would be like a randomized controlled clinical trial. But since the incidence of NAION is so relatively low, it would take millions of patients to kind of answer this question. And because the NAION occurs over years of exposure to the vasculopathic risk factors, so there's no way that we're going to have a study that's going to be a randomized controlled clinical trial. However, what kind of study you could do is a prospective study where the patients are exposed to the agent and compared against themselves in the non-exposure period. So that type of case control study where the exposure can be looked at and using big data is the kind of study that we really need to have for this kind of thing. And you might even have a crossover where a person who wasn't on it was on it later. And so you can compare those kinds of groups. But the best study design, we're really not going to be able to do that. That's a randomized controlled clinical trial.
Is there a plausible mechanism and which patient factors might increase risk?
So even though I said there's no really good biologically plausible mechanism for NION, there is an analogy from tighter control of glucose in patients who have diabetes. So counterintuitively, patients who have diabetic retinopathy, if they take an agent that helps them control their sugar better, some of those patients, even though they were doing better from a diabetes standpoint, did worse from a diabetic retinopathy standpoint. The presumptive mechanism of that is autoregulatory failure. So your body normally regulates blood pressure and blood flow by making the blood vessels bigger and smaller. But under very high pressures or very low pressures or very high glucose or very low glucose, those autoregulatory mechanisms don't work as well. And so it is biologically plausible that tighter control of glucose could lead to increased leakage of blood vessels from autoregulatory failure. And so, by extension, from the diabetic retinopathy work, you could assert that this is the same mechanism in NAION, but it just hasn't been shown yet. It is theoretic only.
And should ophthalmologists screen patients or modify treatment based on potential NAION risk?
I don't think we have any good screening recommendations. It seems to be somewhat random. We cannot predict who's going to get it, so there's no risk factors that we can say this person is more or less likely. In NAION, a small cup to disc ratio is a risk factor for the regular garden variety NAION. But even if a patient had that, we probably wouldn't change our recommendation for GLP-1. We don't know. So currently, I think patients want to know the information, but I wouldn't want to scare the patient either. So what we tell them is exactly what I just told you. There's an association. We don't know if it's causal association or not, but you have to make a risk benefit versus quality of life decision in this regard. For my purposes, I think the benefit of the drugs from weight loss and diabetic control and A1C is more than the risk.
Is there anything else that you'd like to add that we haven't talked about or I haven't asked you that you feel is really important for the audience to know?
I think it's important that patients be their own advocate for these kinds of things, to be informed. And Google can be a devil or it can be an angel. And you should talk to your doctor. So it's okay to Google things and look it up and see there's this association, but really every individual patient is different. And so you should ask your doctor if you have questions about this kind of issue.
Well, Dr. Lee, thank you so much for your time and your insights. And I will never think of ice cream and sharks again in the same the same thought, the same way. So thank you for that. Thank you
You're
for your
welcome.
insights. Have
Take
a
care.
great conference.
Bye.